I'm Alex Jacquez, Chief of Policy and Advocacy at Groundwork Collaborative. When we talk about healthcare policy, progressives often focus on coverage, protecting Medicare, Medicaid, and the ACA, debating the path forward for Medicare for all, or supporting a public option. As a former Bernie Sanders staffer, I take full responsibility in driving some of these debates. But just as critical and much less explored, except on our last panel, is the crisis of our healthcare infrastructure. Doctors, nurses, clinics, hospitals. A future president should undertake a massive expansion of public clinics, hospitals, and providers to bring down costs and provide the backbone that we would need for a universal healthcare system. I propose creating an American health service. As our population ages and consumes more care, the stresses on our current system will only intensify. Since 2005, nearly 200 rural hospitals have closed, and Trump's cuts to Medicaid and the ACA threaten to close hundreds more. We face a shortage of physicians that will grow to 86,000 in a decade, and 350,000 nursing positions are currently unfilled. Just 12% of doctors currently practice in primary care, compared to 25 to 50% in peer countries. Hospital consolidation has reduced competition, increased prices, and cut critical services. Private equity now owns nearly 1/3 of emergency departments, often prioritizing profit centers over equal access to care. Our current public health infrastructure programs are severely inadequate to meet this challenge. Community health centers are radically underfunded, and the National Health Service Corps deploys just 17,000 providers at present. A coordinated public American health service would tackle this monumental challenge in 3 ways. First, we should reimagine and scale community health centers to fill gaps in underserved areas. We should extend their service to middle-class patients and expand their services to include things like mental health counseling and pharmacy services. Second, we should institute a 21st Century Hill-Burton Act, the post-World War II program that funded more than 7,000 hospitals and more than 4,000 communities in exchange for free and reduced cost care. Public hospitals would be placed to meet a median ratio of beds per population and serve as a model employer. We should also establish a fund to buy out struggling community hospitals and protect them from takeover. Third, we should staff these facilities with tens of thousands of new publicly employed providers, expanding residency and medical school slots with an explicit focus on building a robust primary care workforce. As my old boss likes to say, this isn't radical. We have a version of this already. It's called the VA system, and it consistently outranks private care in outcomes and satisfaction. An industrial policy for healthcare would provide a counterweight to our current corporate and financialized system, bring down costs, anchor local communities across the country. Healthcare infrastructure is as essential as roads, bridges, and ports. It's time to build.